Hello and welcome everybody. We're going to just wait 1 or 2 more minutes until people are joining. Okay. I think we have some people in. Yes. Hello, welcome everybody. Good afternoon to our EU-FFICIENT webinar. My name is Teresa Neuhauser. I'm from EIT Manufacturing East, and I have the pleasure to moderate this webinar for the next hour or so, a little bit more maybe. We have some very interesting talks, some really good experts, and I'm sure you will like what they're going to have to say. So yeah, stay tuned. Before we go into the agenda, just some housekeeping rules for everybody. If you have any questions during the talks, we're going to do a Q&A in the end of the session. So after all of the presentations, we're going to do a Q&A. You already have a Q&A tool on the top of your Teams window. And somebody is not muted. Okay. You have a Q&A tool, so if you have any question to any of the presentations, use the Q&A tool, start a new question, and please indicate who the question is for. So if it's for a certain speaker, please indicate who you want to ask that question to. You cannot unmute yourself or put your camera on, which is no problem. Please use the Q&A tool. If there's anything you want to say or you cannot put in writing, in the Q&A session, raise your hand. You have a little button on top, raise your hand, and we're gonna give you the permission to speak, so you can also put your questions to our speakers directly. Okay, that's it. Watch the chat for some hints from my colleague, for some links that you can click that will be useful to follow the presentation. And with that said, here's the agenda. You can see that on your screen. We're going to start with an introduction to EU-FFICIENT by Radivoj Malic. So you know what the project is about for those who have not heard about EU-FFICIENT yet. Then we're going to start with the presentation from Anna Castillo and Clara Prats on the Exalta-Salud ecosystem. And then we have our 2 expert sessions from Alex Pereira and Paola Antionetti, and then we're going to wrap up the webinar with the Q&A. So if we go to the first presenter today, it's Rajaf from CIT UPC, and he's going to give you an overview of what EU-FFICIENT is about. Rajaf, the stage is yours.
Perfect. Thank you very much, Teresa. And thank you everyone for joining. So I'm Rasha from UPC, the UPC Technology Center. And what I'm going to do today is give you a bit of introduction, a bit of context of the EU-FFICIENT project, in which framework this webinar is also organized. So practically, what is EU-FFICIENT? EU-FFICIENT is a collaborative European project that aims at enhancing collaborative processes across Europe. And how do we do that? We do that by establishment of communities of expert facilitators that you will see in the following slides. And we give them the different tools, different trainings, networking, etc., efficient platform through which you can collaborate, co-create, etc. Can you go for the next slide, please? Okay, so as I mentioned, the EU-FFICIENT is a collaborative project. So here you can see the whole team, the consortium of EU-FFICIENT, and as you can see, we are quite a diverse group of entities and different types. So we are a group of universities, research centers, public bodies, association networks, for-profit companies, etc. Okay. So as I mentioned before, the core of the EU-FFICIENT projects are the communities of expert facilitators around different technical or scientific topics. I think the most relevant for all of you here, considering the topic of the webinar today, is the health tech HealthTech community, but also you can probably join the rest as well. So the HealthTech, obviously, I won't read through everything here. I think it's pretty obvious for everyone, no? The integration of technology and healthcare. So here you can see a bit of some examples, obviously not complete, but of some topics that we are dealing with in the HealthTech community. So just one remark before we move on. I just wanted to explain for those of you who might wonder what is actually an expert facilitator. So it's practically all of us that are dealing with innovation and research and managing co-creation and collaborative projects. So it could be from researchers to research managers, project managers, innovation managers, etc. So I'm pretty sure everyone here can find themselves in this category. Okay, so going into something concrete, so you can see a little bit what is in there for you. So how can you benefit from EU.Efficient? So what we've been developing in this project is this whole toolkit going around the EU.Efficient platform through which you can access all the learning tools, all the matchmaking space, the networking tools, etc. So I invite you everyone to join. Here is the QR code, and also in the following slides you will see it as well. For those of you who missed it, it will lead to the same platform registration. So on this platform you can look for partners, you can look for mentors, you can look for collaborators, and then on the other hand you can access to everything that EU.Efficient has to offer, such as training. So we are offering the tailored trainings both on soft skills that I will show on the next slides, and also on the hard skills. So one of the example of hard skills is actually this webinar and the expert session that you will see after the introduction. So I invite everyone to join, and at the end I'll leave a bit of time for you to register if you wish. Okay. So this is an example of the other types of trainings. I just mentioned the hard skills that are specific, scientific, technical learning. But then on the other hand, we think that everyone who handles innovation and co-creation also needs access to training on the soft skills. So here is a bit of overview on the upcoming training courses that you can access through EU.Efficient platform. So I'm pretty sure everyone can find something for themselves here. On the other hand, everything that we do, including this webinar, this will be recorded, is then uploaded to the EU.Efficient Content Hub that you can also access through the EU.Efficient platform. So anything that we think is relevant for the people, such as trainings, guides, publication, etc., it can be accessed through the platform itself. So this is an example how the platform looks like. Looks a bit like a social network. So for example, on the left side, you can see how the newsfeed, how the platform looks like for myself. So practically on the left side in the link session, you can see how you can access the learning modules, how you can access the library that I just showed, how you can post different co-creation projects, how you can look for collaborator and friends, and also you can see the different set groups. And here are a few examples of the different publications people make on the platform. For example, here we put a bit of examples of people actually looking for partners and collaborators in different projects. So on the left, you will see there was an open call that is closing in a few days. So people here were looking for collaborators, and then also you can post co-creation projects, challenges, look for mentor, look for partners, etc. So we invite you to explore and see how you can benefit from the platform. Okay, so maybe we can leave a minute for people who didn't have time to scan the QR code. There are a few things here you need to fill in just to register. It doesn't take more than a minute. Just for your information, once you are registering, you can choose only one community of expert facilitators, but once you are registered, you can choose more of them. So obviously I invite you to join first the HealthTech, that I think is the most relevant for you, where you will see also some other upcoming trainings, upcoming events, both physical and online and hybrid, that we will post in there. So feel free to join, and I hope you like the platform and you can benefit from that. So thank you very much.
Thank you very much, Rasha, for all of those. There's a link in the chat, so you can just click that and go to the platform in case you didn't manage to scan the QR code. And now we come already to the next presentation by Clara Prats, who is the Deputy Director of the Institute of Research and Innovation in Health, IRIS, by the UPC, and by Anna Castillo, who is a Research and Innovation Promoter of the Hardskills Salute Network. And this is a network focused on accelerating medical technology transfer. So, Anna is there to bridge the gap between research and market in health tech. And it's probably quite interesting how to get all those innovations out in the market. Clara, Anna, please go ahead.
Thank you very much. I will start by myself. I'm, as you were mentioning, an associate director of this Institute for Research and Innovation in Health. This research institute is held by the UPC, the Universitat Politècnica Catalunya, which is one of the referral universities on engineering and technology in Catalonia, with more than 30,000 students and 3,000 academic staff. Next slide, please. And actually, this research institute was born last year. We are 1 year old, but in fact, it is the result of more than 40 years working on health tech at the UPC. And in fact, it was preceded by a research center called CREP, a research center on biomedical engineering that was born 30 years ago and that finally evolved towards this, the current IRIS. Next slide, please. Thanks. And in fact, this the creation of this research institute of IRIS is a clear commitment of the university to advancing science and technology for the improvement of human health. We try to bring together almost all the researchers working on health tech at the UPC. We are in a growing phase, with more than 12 research groups and more than 170 researchers and professionals right now. We have given place to 10 spin-offs, more than 60 patents, so we are quite active, and I was mentioning in this expansion phase. And the most important project inside this institute is Hardskills Salute, that will be introduced by Anna in a few minutes. Next slide, please. Thanks. So this is a sample of our research groups. The areas of research cover from bioinformatics to biomaterials, also including biomechanics, robotics, signal analysis, computational biology, serious games, radiation, instrumentation, medical image, and virtual reality, also data science and artificial intelligence, as you will see with Alex Pereira as an expert today. And I have chosen just two very brief examples to illustrate such a variety of topics that we cover from IRIS. This is the first one from our biomaterials research group, and that was funded by an ERC. They work on bone scaffolds, on trying to generate these osteogenic materials that facilitate bone regeneration. But there's a problem with bacterial infections. They try to prevent by being inspired on biological reality, in this case on some insects' surface that have a special topology that prevent bacterial adhesion and growth. And they are transferring this topology in these osteogenic biomaterials so that they can prevent these bone infections. Next slide, please. And another very, very different example from our biomechanics research group. In this case, you can see in the top the standard of care exoskeleton to help on rehabilitation of different patients. And in the bottom, the device that was developed by our research group that optimizes this gait pattern during the rehabilitation. The video is a little bit stuck, but I think that you can more or less imagine. They are just two different examples. We could mention thousands or hundreds of them. This is an image from our launch event last year with a sample of our researchers. And it's just to say that we are open to any synergies or collaborations that you can imagine. So please, if you are interested visit our website and contact us, and we will be pleased to discuss anything with you. Thank you very much.
Thanks, Teresa. Thanks, Clara. Hi, everyone. So let me now introduce you briefly to the HealthTech Salud project. HealthTech Salud is an innovation network focused on health technologies, born and led by the IRIS, the Universitat Politècnica de Catalunya, the UPC. You can see this QR code here. It will be throughout all the presentation, so you can use it to connect with us on LinkedIn. So next slide, please. All right, so our network is representative of the research in health happening in the northeast region of Spain. You see here in the map, this is known as Catalonia. In fact, this is a project that is promoted and funded by the government of Catalonia in Spain to operate as a key instrument to strengthen collaboration, connect innovation ecosystem, and maximize the impact of research. So if we move on to the next slide, you can see that as a network, we include 122 research groups who are our members, and up to our 50 institutions from all across the health innovation ecosystem in Catalonia. This includes research institutes, universities, hospitals, and companies. As you can see here in the map, HealthTech Salud is broadly representing the research activity that is happening in Catalonia, focused on health technologies. So moving on to the next slide, as I said, our focus is on health technologies, a very broad topic, which means that our research groups are working in various subjects, such as you can see, artificial intelligence and data science, digital health and software, medical devices, robotics and automation, advanced therapies and biomaterials, imaging, optics and visualization, simulations and biomechanics, and virtual reality and human interaction. All of them applied to the health sector. So next slide, please. Our mission is to transform research to real impact for society. We do it by supporting our members, our research groups in the network throughout all the process of transferring the research to the clinical sector and to the market. We have several activities. They go from offering them training and capacity building, promoting idea generation and fostering synergies via several events. And finally, of course, we offer them close valorization assistance and spin-off creation support. Next slide. Yeah, as I said, we are a network, and as a network, it is at our core to connect the health ecosystem. We, because of that, don't be afraid to reach us if you're interested in connecting with any of the Catalan research and entities from the map I showed you before. So as it says here, we have access to industry partners and clinical collaboration for possible funding proposals. And we also offer exposure to promote opportunities for real connections. We also do so by co-organizing events and seminars with other projects like this webinar today, as we have experience in training and capacity building for researchers and inventor building programs and spin-off creations. So if you're interested in staying up to date to our open programs from HealthTech Salud, or you're open to collaborate with us, we invite you to follow us on our social media. We have LinkedIn here in the code, in the QR code. We also have Instagram, and we also have our website that is healthtechsalud.com. So that's all from my end, and I hope to collaborate with you soon.
Thank you so much, both of you. That was very interesting. And now we come to our first expert session towards foundational models in health data science from rare diseases to prevalent diseases by Alex Pereira. He's a physicist and electrical engineer with a PhD in physics and a full professor at the Universitat Politècnica de Catalunya and coordinator of the B2's lab Bioinformatics and Biomedical Signals Laboratory. And he researches and he focused mostly on applied data science methods for clinical data and bioinformatics, and currently serves as the director at the Catalan HealthTech network, Shartech Salud. And he also co-founded 3 spin-off companies. So we really have an expert here with us today. And Alex is going to share his slides himself. And just a small reminder, if you have any questions, please put them in the Q&A tool or in the chat, and we're going to address all of those at the end of our webinar. Alex, go ahead.
Okay, thank you very much. Maybe you can hear me, I hope, and you can see the slides, I hope.
Yes, we do.
Thank you very much for the confirmation. So, and also thank you very much for the organization to let us talk in here in the scope of this very nice project, which is very interesting to us as well. In this talk, I want to talk about 2 concepts, maybe 3, that we are working with, and in which, in the 3 of them, we are looking for cooperation across Europe to build up on something that we believe it might be very, very interesting for the future of our patients and our population in general, and especially in health. So this is a talk on data science. And in these 3 cases, I will cover from rare to prevalent diseases, especially in type 2 diabetes. And let me start with the rare diseases projects that we are working with. And as you know, rare diseases, it's a difficult and tricky matter. Most of them are monogenic, and most of them are pediatric. And it's a huge problem because it takes like a mean of 8 years to receive a good diagnosis from a number of specialists, which always it's a long journey. And for a part of these kids, the survival time it's 5 years. So it's a very pushy subject in which gaining access to a good diagnosis quicker or the quickest, it's actually one of the goals that we should pursue. In this area, we work in an European project called Share for Rare. This was an European Commission project, and it was a very nice project because we were in this project using an internal profile of the user, and we were showing the user with some neighbors. And these neighbors were computed in a way that the platform was behaving like a social network, very similar to LinkedIn, but in this case, using the data provided by the patients. And this data was provided through login using something which is a set of codes, which is they correspond to the symptoms that the patient, in this case, kids, and these data were provided by the parents or the carers. And these codes, they were searched using free text, and they were inserted, attached, DM, or linked into a particular patient using an ontology, which is the human phenotype ontology. And this is a big effort by the Monarch Initiative, trying to standardize a vocabulary of phenotypic abnormalities, which means essentially symptoms. So this vocabulary, it's large and very technical, and it behaves like a hierarchy. So whenever you have a patient, you can say that this patient has an abnormal concentration of blood glucose. But you could also say that there is an abnormality in the homeostasis of this glucose, which is it's higher in this hierarchy. Or even you could go deeper in this hierarchy, stating in which sense this abnormality on the concentration tends. So whether it's hypoglycemia or hyperglycemia. In any case, if we are able to describe a patient with very deep codes or descriptors of the symptoms, we are in the context that we call deep phenotyping, which has nothing to do with deep learning in this case. But this deep phenotyping is allowing us to build an automated diagnosis or it's allowing us to compute with the patients. And this is what we do, what we did in this project. We were in charge of the complete data science aspect of the project, and we were using this ontology, which is large. It has 42 levels of in this hierarchy and 25 branches covering everything that can that the symptom can be. So, for instance, in a particular patient in this simplified hierarchy, the system was annotating this patient with some particular notes, and then we could, with this information from this patient, compute similarities between other patients in the website. So maybe in one patient, we had one common part of the symptoms, and maybe in other patients, we had another part common on the symptoms. In any case, the system was linking them together in a computation of similarity, how similar these patients are in terms of symptoms. And also we could describe a particular disease in the same set of HPO codes. So a disease can be described as a clinical entity with a set of annotations on HPO. And in the same way, whenever we have a particular patient, we could propose one particular disease for diagnosis as opposed to a different disease, just using this similitude, which is a bit complex, but it's very interesting. And here you can see a figure that represents a similitude between any two pair of patients. So one patient, for instance, is one row, and another patient, it's one column. So the similitude between one or another, it will be one dot in here, and this dot is darker, the more similar those patients are. So if we see blocky structures on here, it means that we have groups of patients that they share a common a common set of symptoms. So probably the diagnosed vector is going to be similar on this common group of patients. This has also been useful to check on undiagnosed patients how we can unravel or discover new diseases. This means new entities of symptoms that maybe they are not being described yet. This is a 3D representation of this mathematical approach. So on green, you can see diseases like this one, which is narcolepsy type 1, if you can read it, and on blue are real patients. In this simplified mathematical representation, we can see lots of diseases on here. And on here, we see a narcolepsy type 1 patient and also a Smith-Magenis syndrome patient. And both patients, they share mutations in the clock genes that they somehow modulate our circadian rhythm, and they are showing anomalies on diet and sleep behavior. So this means that just from the declared symptoms, these patients were grouped together in this representation, in this case, close to this entity, this disease, which is narcolepsy type 1. And maybe the most interesting thing on here is that we have also non-diagnosed rare patients that we could use mathematical approaches to try to connect these undiagnosed with the cluster of patients that they were more similar to them. So this is what we did, but we also did a different other approach to that, which is building a social network. In this, it's what we call the people like me. But essentially, this is a mathematical function that can be as complex as you want. But the main concept on here is that we were mixing phenotypic distance, so how two patients are similar to each other in terms of symptoms. We were also using if the patient had disease, diagnosed disease, we could also use this to compute this metric or this score. And also, if the patients declare a location, we were using geolocalization in this integrated approach. This integrated approach was showing the user with some neighbors. And these neighbors, they were other users that they had a similar set of symptoms, maybe a similar disease, and they were living close to each other. So we were giving them the opportunity to talk to each other, to communicate if they both agreed or consent. And also we were mapping into this map also the organizations that usually are rare disease patient organizations, that they had information on how to which genetic diagnose you should use for a particular disease, and several other tools that are much very, very interesting. So this also yielded to these patients to have lots of communications, for instance, on how to travel whenever you had a kid with a muscular dystrophy, for instance. And so the families were helping to each other and discovering each other. And it was a very, very nice project. The second element that, or the second action that I wanted to talk about, it's on how we approach prevalent diseases in a new way, thanks to the new advances in data science that we are seeing in these past 6-7 years. Probably, you know, type 2 diabetes mellitus, it's a growing epidemic. And we were having very interesting conversations with a local hospital in Barcelona, and also an entity that represents the primary care centers in Catalonia area. They were telling us, explaining about type 2 diabetes. And they, medical doctors, they commented that this disease, which is very prevalent, it shows a variable progression, which is heterogeneous. And these both elements of progression and heterogeneity, it's kind of ignored in the individual patient management. So they were thinking, they were suggesting that maybe we could treat type 2 diabetes as a mixture of other conditions. And we were obviously trying to approach this using data science. In this case, we consider the trajectory of a patient, which is the evolution on time as we age, using a multivariate time series, which again, it's something complicated, but we did something very simple on here, which is trying to replicate the data that we had from the population into the output using a very simple algorithm, which is trying to compress this information in a minimal code. If we successfully compress this information using a minimal code, then we can look at this code and try to recreate the groupings that we see into the code, so that maybe we can see different evolutions on the type 2 diabetes. And this is what we did using a strange algorithm, but using roughly a quarter of million of Catalan population, where we get primary care data from demographics, diagnosis codes, and prescriptions and purchasing, plus some other variables. The approach that we are having into these models, it's interesting. For instance, something that we do is that we do not publish supplementary material as we used to do, meaning a set of Excel tables or annexes onto a PDF. But what we did, it's to publish a dashboard that it's open. So in this dashboard, you can see the results of this paper, that roughly the results were that we discover 7 groups of evolution of type 2 diabetes. And then you could see the classical tables on supplementary material, but something which is very important for the medical doctors as well, which is the grouping itself in terms of data science. So you can see on here the different groups where one point, it's one trajectory. So it's the patient across time for one particular trajectory. Into this representation, we could map interesting features, for instance, the years of insulinization of one particular patient, and see how this insulinization time is different across the groups, or also check which were the main comorbidities that the different groups had. For instance, some groups in one set of clusters, they had some chronic kidney disease develop versus some other groups they did not have. And this way of looking at this data of the whole population of what we are, it's quite new. And now we have tools for doing this if we put together the data and we have a nice collaboration projects. And this takes me to the third part of my talk, in which starting from this work on type 2 diabetes, we were thinking, how can we translate what is happening in nowadays in AI, that we all use ChatGPT and Anthropic and some others, in health. And this is interesting. So if you ask ChatGPT how it is built, it will tell you that it's built using a foundation model. What is a foundation model? If you ask ChatGPT, and this slide was generated from ChatGPT, so ChatGPT says about itself that the foundation model, it's like an engine, right? Where ChatGPT, it's the car. So the foundation models, they fit ChatGPT, but it's one of the applications of these foundation models. These foundation models, they were built using text, trained using lots of text, and nowadays they are multimodal. But a chat interface is just one of the things that you can do with one of these foundation models, which is essentially a language model. In the way ChatGPT is done, it's something. So the way ChatGPT is used today in medical sciences, it's something like this scheme, right? So we have some population that it generates some evidence, and then we have clinical trials, research that conform a medical corpus, which is lots of text. ChatGPT, OpenAI, and all these companies, they build these foundational large language models using medical corpus and also half of the internet. Nobody knows really how big it's the corpus that they are using to fit these models. And nowadays, it's quite common that medical doctors, they use these LLMs that they have been trained with text into medical practice. They will not confess, and probably there is some medical doctor in the room, but when you ask them, they do. If we look back on how ChatGPT was trained, it's trained using a tokenizing of text. So how this works, well, whenever you have a text, the text is split in something that it's called tokens, and each one of the tokens is essentially translated to an integer. So then these deep learning models, they use these integers, using also some other transformations, right, to predict the next integer that's going to appear in the sequence. And if the sequence is a question, the next tokens are going to be an answer. One of the opportunities that we have in medical science and clinical research is to use the same idea, but instead of tokenizing text, we could tokenize evidence. So can we build the equivalent of large language models, but using directly the data from the patients and not the text built from the medical corpus, and then use predictions from direct evidence for the medical practice, because it sounds like a nice idea, right? So this means that instead of tokenizing text, we are getting back to our database. And in this case, we have a very nice and very complicated to access database of routinely collected health data in Catalan area. And then we could get the events that all of us are injecting or storing into this database. And then whenever we see a patient at a time t, we could use all our history as a seed and then use one model trained directly with medical evidence to generate a predicted trajectory. And this trajectory, what it contains? Well, it contains directly records. It's not text. It's going to contain maybe a prescription that most probably you will get, a particular laboratory, or maybe an ictus that you may have, that it's the most probably event from the history set by this large language model, in the same way like ChatGPT, it's predicting the output of text whenever we ask ChatGPT a question. So it's a parallel trajectory that we can also add text to that, trying to enrich, but the prediction made from the evidence. So let me show you a demo. On here, this is a live website that we are using internally. This is an internal tool that we use on the lab. And in this case, you can see on the right, a set of codes, which is translated to this tokenization. In this case, you have a vector of diagnosis that you get a particular ages. This is ICD codes. And we can translate this codification also from text. But in this case, the large language model, it's only translating this text into tokens that a particular model is going to use. In this case, this model, we have loaded on here 2 of them. This model, it's one of the foundation models that we have built jointly with CDAP and Sant Pau Hospital. It's built using 1.5 million patients suffering, some of them type 2 diabetes, and it's an 88 million parameters model. From this model, we can, using this observation of the patient, generate a synthetic trajectory. What's a synthetic trajectory? Okay, so this is the tokenization of the particular patient that we are adding. And then on here, we have the observed tokens, this trajectory from the patient, and the model is generating supplementary tokens with some more or less confidence, which are the most probable tokens generated from the seed that we observed. We can load this into a timeline, and this timeline, it's essentially a timeline of our age as we grow old. And on here, you can see the seed, which is the real observations of this particular patient, which is fake in this case, right? And then how the model, it's predicting different codes, let them be alterations on different laboratory measurements, like, I don't know, abnormal glycated hemoglobin, or maybe new diagnosis. For instance, the conversion of an hyperglycemic into type 2 diabetes with a prediction of when this is going to happen. We also use on this a mixture of large language models, but in this case, they do a text summary of the tokenized trajectory. But in this case, the tokenized trajectory, it's all built using these foundation models, right? So we have published a part of this in one of the papers that we published on past year, we were trying to predict new comorbidities appearing on the next 4 years, and also whenever a particular patient started to use an insulin-based drug or losing the glycated hemoglobin control. For that, we were using one of these models applied to this particular case in the same way as ChatGPT uses a foundation model for building a chatbot. And some of the findings that we reported on this is how the model is thinking on the different comorbidities. And for instance, we have 2 different sets of different comorbidities that they also represent the evolution of this particular patient. So these machines that they have seen 1.5 million patients, they have an internal representation on how type 2 diabetes is spread and the structure of the patients across our population. Most interestingly, we also have a distribution of the pharmacology on these patients, and also we can play with the effect on the evolution, which is something that we are working now on, whether we have predictive power on the effect of alternative realities in the prescription of a particular drug. And these models, they show good predictive power in both comorbidities prediction and treatment prediction. Please be aware that having predicting power in the treatment, in a sense, it means that we are predicting the behavior of the medical doctor when dealing with this diabetic patient, which is also something very interesting to think about. So in this case, we applied to these 3 cases in which when the patient will be under insulin-based drug or non-insulin based drug, whenever the patient could suffer from some comorbidities like hypertension, cardiovascular disease, other neuropathies, chronic kidney disease, or ophthalmological complications, and also when the patient was losing the glycemic control on the timeline. And this is essentially what we can do in these models and what we are trying to do during this year, which is, believe me, very, very hard for us. So for this, we are looking for collaborations across all of you. If you are also looking for a postdoc or doing a PhD, we are hiring. If you have more information about our lab, please connect to our website. And don't be afraid of joining the lab. The worst thing that it can happen is that you get married. And we have a history of building couples within the lab. So I'm sorry, that's the risk maybe that you get if you join the lab. So if you want to know more, just look at our website or connect to the IRIS Institute, and also the very nice project that Anna introduced, which is HealthTech Salud. And with this, and I hope that in time, I thank you all of you for your attention, and I will end my talk.
Alex, thank you so much. That was very interesting. So if you would like to know more, please have a look at the links that Alex provided. You know, worst thing you can get is money, as he said, and maybe find your life partner. So if you have any questions for Alex, please put them in the Q&A tool and we're going to address those later. So, and now we're going to go to Paola Antionetti from Politecnico di Milano, and for our second expert session on the future of health, technology, foresight, and disruptive innovations. And I was just reading through Paola's bio, and it's very impressive. I'm just giving you the highlights now. She's head of laboratory of modeling and scientific computing and professor of numerical analysis at the Department of Mathematics at Politecnico di Milano. And she is the author of 2 books and more than 130 scientific publications. She's received several scientific prizes, including the Young Researchers Prize from Italian Society of Applied and Industrial Mathematics and the Ecomas Jacques-Louis Lyon Award in 2020. Her research focuses mainly on developing advanced mathematical and computational models for applications in neuroscience and engineering seismology. Very impressive. Paola, we're looking forward to your talk. The stage is yours.
Thank you. Thank you very much. I'm here as a professor of Politecnico di Milano and a member of the Technology Foresight group, which has been established in 2020 at Politecnico di Milano by an initiative of the rector at the time and then confirmed by the current rector. And it's a strategic advisory board with the aim of doing the Technology Foresight exercise, bringing together networks of academic and stakeholders. The idea is to work based on employing scenario methodology. I'm going to go through this more in detail in the next few slides. So our mission is to advance the knowledge and the understanding of how technology can empower our community and facilitate the interaction with industrial partner or societal stakeholders. And as a byproduct, of course, also to promote and increase awareness of polytechnical expertise in area that can be further valorized. So can we go to the next slide? So let me start with spending like 2 minutes on the methodology, which is as common to any kind of technology foresight methodology. So what is foresight? On the one hand, it's a human ability that allows us to think ahead and consider, model, create, and make plans to respond to future events. So methodologies for foresight are established frameworks, working frameworks that try to put together different perspectives by reading weak signals. How it's a systematic activity which helps and support not a short time prediction, but a long time future of science and technology. And as an ultimate goal, these can be helpful to support inform policy decisions. And let me make very clear, foresight is not forecast. So there's no future prediction that's impossible. It's a work by scenario. And to read through weak signals or signal of steep forces that we can read today, to put them in a system and try to figure out possible, plausible futures, and which are the key habilitating factors to go towards one future or towards another future. Can we go ahead, please? So what are the main ingredients in any technology foresight exercise? First of all, there are the so-called steep forces. So STEEP is an acronym, I'll come back later on, that stands for societal, technological, environmental, economics, and political forces, which can be read in our current environment. So what are the external forces that can support or drive one possible future or another possible future? Then there are the signal of changes. These are weak perturbations that can we read in today's life, which might play a role or might not into forecasting these different scenarios. And then, of course, there are technologies. So which are the technologies that put together in the same context can drive more impact or less impact in different possible scenario. And in doing exercise, the exercise at Politecnico di Milano, so this the last 3 years exercise, I'll make a practical example. Of course, we have involved colleagues from Politecnico di Milano, which are experts in the technological development and very expert in some sort of technologies, and of course, healthcare professional, because our 3 years journal has been dedicated in trying to answer to this question: which are the most transformative technologies that have the higher possible impact in the broad concept of health in 2040. We can go to the next slide, please. And this is an example of steep forces we have identified in the broad concept of health of human beings and society and environment at large. They are clustered in the 5 possible declinations, which includes the analysis that typically is done, and there are some of them, so steep forces that are driving the changes. Some of them are to some extent quite expected. Some of the others have been obtained through desk analysis, interactions with our colleagues and with the external stakeholders. The next slide, please. And that's how the journey, how the technology foresight methodology usually evolves. So there's first a reflection on the signal of changes, so weak perturbations. There's a work of desk research on possible emerging technologies, and a clustering with respect to the analysis, the dimension given by the steep forces. Then there's a very structured activity of interviewing experts, which are scientific researchers, which are expert in the technologies which have been identified, as well as protagonists of the global health environment, doctors, medical doctors, or healthcare professionals in general, and policymakers. Then through an innovation factory, there's a collective reflection towards possible scenarios and futures, and what are the key habilitating factors that can sustain or strive against the realization of such futures. There's also a phase in which we have asked collaboration from external stakeholders and more general expert community surveys. A final exercise of collective exercise where we take all the previous impact and we reframe them. And we discuss which are the more habilitating technologies which might drive or sustain a given possible scenario, or which might have a more transformative effect to realize a different scenario. And from this, we construct the synthesis, identifying the most, so the 10 more technology which have a potential more transformative momentum, as well as some take-home messages. And now I would like to tell this story, considering this our 3-year journey we have carried out at Politecnico di Milano. So the next slide, please. The next one, so the future of health. So this has been a very long, 3 years old reflection and journey and work. And we have decided to organize our 3 years in as follows. So in the first year, we have a focus on the concept of personal health. So which are the technology which might have a most transformative momentum in the future of personal health. In the second year, we enlarged a little bit the perspective and we moved to the healthcare system. So what are trying to answer the question, what are the most transformative technologies that might have an impact on the healthcare system? That was the exercise of the last year, and now we are concluding the third last year, enlarging again the perspective and focusing on the ecosystem health. Clearly, that's only a rhetoric clusterization which decided to employ to organize our exercise, but there are not clear borders between each of the layers because they are all strongly interconnected. Can we move to the next one? So in the rest of my talk is going to give you some more details on the first 2 years of the exercise, starting from the first one, so personal health. And that's the question we started from, how our concept of personal health will change and how we can exploit the potential of transformative technologies in 2030. So having a focus on personal health, that's the summary, which somehow gives a graphical representation of all the journey I discussed and all the methodological approach we have come with. So on the left of the panel, you see the STEEP forces. So on the left and on the right, cluster with respect to the STEEP acronym. And the bars you see at the bottom are those STEEP forces that have been selected as those that will have a more impact or will have a predominant role in the concept of personal health. And in the picture in the middle of the slide, which should remind you and health, you will have on the left the technologies which have been selected, and in particular the ones with the highest potential transformative impact are highlighted in bold, and also as the size of the square is connected with its potential of transformative impact. On the right, you see the insights we have collected, and all the arrows show you the links between technologies and insights. So which insights are connected to the technology and the corresponding technology, and vice versa. So from this analysis, we came up with 4 take-home messages, which synthesize to some extent the work of technology foresight. So first, there is a dimension of digital health. So humans and data will be most probably more and more a continuum in hyper-connected societies. So to simplify it, so the data is the new gold and we are the data. There's another dimension we just has been emerged throughout our analysis, that is a change of paradigm So we will most probably, so there will be a more and more proactive attitude towards human health. So less cure, more prevention through prediction. So there's the so-called health continuum. There's also a clear shift towards an increased tailor medicine. So we have cognated this in a simplified medicine, where the peculiarity of each human being is taken into account and can be habilitated through technological improvement, hyperconnection, the availability of data in a continuum setting, and these can be supported or sustained through technological development, so technological progress. And there's therefore take a message, which brings to the, sorry, if you can go back for a second, thanks. Which brings, of course, the ethics dimension and the sustainability dimension of this pervading use of technology for the health of person. So that's, of course, brings the question of whether these will be really a major shift, or whether these can be acted as a driving to further amplify the gaps or to reduce the gaps. Next slide, please. So after this one here, we move to technologies for the future of the health of person to of people to the healthcare system. So what are the most transformative, so the technologies with the most transformative potential for the healthcare system in 2030? And after our technology for science exercise, if we can go to the next slide, we came up to this synthesis, which is representing this graphic picture, which has more or less the same structure as before. Now, instead of a heart, you can read at the bottom a brain. Again, the same steep forces we have identified at the beginning of our journey has been highlighted in connection with the dimension of the analysis, which is no longer human well-being and human health, but it's the ecosystem. And on the left part of the panel, you see the top selected technologies which has emerged from our analysis, as well as how they are interconnected with the insights, where again there's suitable changing drivers of changes that we have identified, taking into account all the steep forces and the technologies which might have a more transformative potential. Again, so if we can go to the next slide, the take-home message that can be read after this second year of exercise is these three ones. So there's an emerging trajectories where the patient is going to be the place of care. So more digital healthcare system, and with a push forward to decentralize care, to simplify deliver wherever you are. So there's also a very strong dimension where there is an imperative that is on healthcare literacy. So the need of being so all on the same pages, and the healthcare system has to make sure that all the dimensions and all the actors of the healthcare system are have the same literacy, which is shared. And then there's a provocative or less message, which is will AI, artificial intelligence system will most probably have a central role in the future organization of the whole healthcare system, but will AI and this massive use of data make the healthcare system more human? So we have figured out with this simplified term as human AIs. And now I'm going to the conclusions because I think I'm running out of time. So what is the next stop? So currently we are enlarging to the last, let's say, perspective and moving to our analysis of how will emerging technologies will transform the health of our planet in 2040. And we are planning to conclude this last year of exercise and deliver the final analysis by, let's say, next summer, so after the summer. And with this, so all our, we can go probably to the final slide, please. Okay, I want to thank you. All our materials are freely online on our website, and if you are curious, just feel free to drop us an email. Thank you.
Thank you so much, Paola. That was very interesting. Let me have a look if we get any questions on there. Let's give you a little bit more time. In the meantime, I actually have one question for you, Paola. So you talked about those Foresight methodologies. Is there any limitations, when you apply them in the healthcare context? Or what are the limitations to that?
Okay. Thank you for the question first. So the technology Foresight, which is very well established and has a long tradition, of course, finds its primary, field of applications in industrial development, right? This is typically run in large companies to anticipate or to position themselves with respect to technological innovation in due time. Here, the perspective is completely different. We are a public institution, so we are at the service of the whole society. And indeed, typically, when developed at private level or company level, there's always the last step, which is action. That's not our mission. So the idea is to be at the service of the society and the university and to read possible scenarios and to anticipate possible scenarios, especially because we are a technical university, so we produce new knowledge and new technology. And despite not being we are a technical university, but it's clear that the future of health will have a massive, we already see it, technology will be massively present in the future of health. And this is why our institutional bodies and governing bodies thought that we do need to make such a reflection. But the methodology is general. It's just a way of thinking and systemizing and approaching the future in reasoning with possible scenarios and habilitating key factors and technologies.
Thank you so much. Just got the first question here in our Q&A from Stefano, and it goes to all of the speakers. So please feel free, whoever wants to answer that. In health tech, where do you think academia creates the strongest synergies with external stakeholders? And where is collaboration still particularly challenging? It continues. For example, with public healthcare systems, pharma companies, AI/data companies, what do you think is still missing to bridge the gap with those sectors, if anything? Who wants to take that question? Alex,
Well,
maybe you want?
Yeah,
Yes.
I can comment something. So it's a very good question and a very difficult one. So maybe in the area that I know best, which is AI applied on health, the lead on this, it's not on the academia. So it's interesting because now the edge of AI research, it's not even in Europe. It's in China and USA, and also it's placed on commercial companies that they have obviously commercial interests. In the case of health, this is worrying because who's gonna take care of the patient itself? Because we in the academia, we look at the patient as a patient, not as a buyer, right? Not as a client. But to do so, we need more cooperation across European partners. And the European Data Space Initiative is an important one, but it's also a very difficult one. And also the public healthcare systems, when we have tried a spin-off and tried to sell to a public healthcare, it has been impossible. It's so difficult to sell to the public health system, at least in Spain, but I think it's going to be very similar to the rest of Europe. So maybe in Italy it's going to be similar. I don't know, Paula, maybe you can comment about this, but we have several challenges on this for sure, and all of them are summarized in the question.
Yes, if I can add a comment, I fully agree. I mean, one of the dimensions that clearly pop up during our analysis is this technological giants pervasiveness, which of course, and the dimension public-private, which of course comes with a lot of more questions and comments and raise points of attention, both at a very practical level. So how you can make this data interoperable between different actors which are driven by completely different forces, because on the one hand, there is the country or the government, whenever the health is public. And the other hand, there are these tech giants, companies, which of course are driven by business rules. And then there's an even more concern, an even more driver, which needs attention. Because the different scenarios can be foreseen. What about the ethical use and the consequences of this massive use of data and artificial intelligence instruments in a context such delicate as the health of people and of the society at large and of the environment? I'll make this provocative example. So almost everybody now wears wearables that records any kind of data, right? And these data, most of the time, are not shared with your home country, but with some, private partner, which is the one that has product the device. But what about if one day I go to apply for an interview? I go to an interview to apply for a job, or I go to the bank for asking a loan, and these data are used not only to improve my, tracking of the level of sugar in the blood or my heartbeat or my pressure, but also to decide whether I'm worth of the job, the loan, or the health insurance. So that's a very, very delicate point where technology has to really, support and be part of the journey, but where ethics and, collaboration and country, public institution relation need really to play an important role.
Thank you, Paola. What you just painted here sounds like a new episode of Black Mirror. So let's hope it doesn't get to that one yet. I'm just conscious of the time here, and I don't see any more questions so far. So I would like to ask Raja back on stage because, all of what we heard today, I mean, in this project in EU.FFICIENT, we're working on that, giving the knowledge to other people, training those peoples. And you have mentioned in the beginning that we have training modules, we have materials, we have a platform. Where is this platform? Is it free of charge? How can people participate? And where's more webinars? Where's more live events in case people are more interested in the topic, and how can they reach us at EU.FFICIENT?
Perfect. Thank you, Teresa. Very good question. So maybe you can go to the next slide. I believe there is still a QR code over there for the people who haven't had the chance to scan it. So to answer your question, everything that we offer through Efficient is obviously free of charge. The only, let's say, requirement is for you to register, and then you can access everything from the trainings to access to the different events that we organize, etc. So practically everything there is available for you free of charge. So there you can check and also access to the previous webinars that we recorded, also as well as this one. And in the part of events, you can check the different events in the different SEP groups. So you can see the events that we will have physically, online or hybrid. You can access everything through the platform itself.
Great. Thank you so much. I just saw another comment in our chat, Despina agreeing with Paola and Alexandra on the previous comments, and preparing, saying some medical data in Oracle in the US. Thank you for the comments. That was very nice. Go to the platform, everybody that has not scanned the QR code yet. This is your chance and your hint to do that. I thank all of our speakers for taking the time, for providing your expertise. It was very interesting, and we had our audience here for almost 1.5 hours. So thanks a lot. Stay tuned on our website and our social media channels of EU.FFICIENT. We're gonna put the recording out there. We're gonna post some more interesting insights. And yeah, that's it for today. Have a very good afternoon, and see you at the next EU.FFICIENT webinar. Thank you. Bye-bye.
Bye. Thank you.
Thank you. Bye-bye.
Goodbye and thank you.